Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference with Delaware's response to COVID-19. I'm joined once again by Pam, our sign language expert for the deaf and hard of hearing. I'm also joined by Dr. Carol Rattay, the Director of the Division of Public Health. With us again is AJ Shaw, who's the Director of the Delaware Emergency Management Agency. As always, thanks to both of you and to your teams for the tremendous work that they're doing as we try to get all Delawareans vaccinated and keep Delawareans safe from COVID-19 virus. We have some good news today, and to start off with some really sad news as we mourn the passing of Delaware's 70th governor, Dale Wolf, who was also lieutenant governor under former Governor Mike Castle. Dale, to those who knew him, was just a wonderful, kind human being, 96 years young as he passed away, and was always thinking about the president, the future of our state, a former business executive with the DuPont company, leading businesses overseas, had a lot of interaction in China for DuPont and for his own businesses, and was just a great person to be around. We also mourn the passing of all those tragically killed in Boulder, Colorado. Communicated with my former colleagues in the House of Representatives in representing those areas in Colorado, and Governor Polis, and our thoughts and prayers go out to their family and friends and to that community dealing with that terrible tragedy. We do have some good news today that we'll talk about as we continue to vaccinate Delawareans and open up the availability of vaccines, which supply is increasing. We had our White House task force call this morning. Jeff Zients is the President Biden's point person for that, reported of the increase in vaccine supply that we'll be seeing over the next several weeks and continuously through the spring and summer, and importantly, an uptick and upsurge in the availability of the Johnson & Johnson one-dose vaccine, which we should see in another week or so. That's all really good news. We're getting the vaccines that we're receiving from the federal government out. We continue to prioritize those who are 65 and older, essential worker populations, as we've added those to the list of our vaccination clinics. So we've had a really fantastic clinic at Dover Downs Speedway, first stood up by our federal partners at FEMA, and now over the last couple weekends with AJ's team and public health's team at DEMA and DPH. Visited the last 2 weekends. We are finishing up with the 65 and older wait lists that have been registered and targeted towards to them. We were doing educators and public school teachers and teachers in the private schools, as you may recall, as directed and encouraged by the White House task force. And then now over the last weekend and last 2 weekends, I guess, in particular, focusing on essential workers in those businesses. I did see a list of the individual businesses whose workers signed up, which include basically our cities and towns across our state with all their frontline sanitation workers. Again, the focus on these essential workers who are not working remotely. We vaccinated thousands of those essential workers over the weekend at Dover Downs, and a really diverse group of businesses, from hospitality to food service, bars and restaurants, Port of Wilmington workers, manufacturing facilities, a whole list of those essential workers across our state. Thousands of others got invitations to be vaccinated, which were they, for one reason or another, weren't able to take advantage of. And we have started vaccinating and are true to our commitment to those people under 65 from 16 to 64 with pre-existing health conditions. We've directed them to go to their primary care physicians, other healthcare providers and hospitals so that those experts could make the determination around their health conditions, pre-existing conditions, but again, prioritizing those folks. Also prioritizing Delawareans with disabilities, working with Easter Seals and other groups to make sure that we vaccinate those individuals and their caretakers. And so look for the opportunities to get vaccinated through those venues. We continue to feed our waiting list to the curative sites and to our large vaccination clinic at Dover Downs. Today, we opened up registration for Delawareans 50 years and older. Already, I'm told, as we were going live with this press conference, we have about 7,500 which have already signed up. That's actually considerably less than the initial sign up for our 65 and older population, but it will open up and enable more folks to get the vaccines that are being supplied from the federal government access to those appointments. We will continue to prioritize essential workers. Your employer should be signed up with the state. I think we have quite a number of employers signed up, and we feed them appointments, and they make those available to their employees at our major clinics. So we're making real progress. We'll go through those numbers in a minute, but I do want to thank AJ and his team at Public Health. You'll hear from AJ and Dr. Rattay in a minute about those efforts. And everybody who's making the opportunity, we'll encourage. We are continuing to see some hesitancy, and I would encourage those who are a little bit hesitant, maybe wait to see what happens with their neighbors, with other family members who are being vaccinated. Yeah, talk to your family members, talk to your friends who are getting vaccinated. Remember, this is for you to protect your health and wellness. If you're younger, you may not feel as at risk as our senior citizens, and you're not. But it's important that you get vaccinated to protect yourself from serious disease, potential for hospitalization, and to protect your loved ones, your family members around you by becoming vaccinated. Our goal is to get as high a percentage as possible Delawareans to get vaccinated, and we're making some progress there. So let's look at the data. I am a little bit concerned, and I know that we did hear this on our White House task force today, with, frankly, the leveling off, now a little bit of an uptick over the last 2 weeks, I would say, in new positive cases. That is somewhat concerning to us. Worried a little bit about activities over the St. Patrick's Day weekend and holiday, with some maybe undisciplined activity in bars and restaurants and private parties across our state. Well, we're seeing some of the ill effects of that. New positive cases on a 7-day moving average is up over 200. We were comfortably under 200 a couple weeks ago. Our hospitalizations have ticked up a little bit. We hit a low of about in the mid 80s, I want to say 83 or 84 a couple weeks ago. Now we're back above 100 to 107. Percent positive, still below our 5% target, but obviously concerning with those new cases on a daily basis. We don't have quite the number of tests being done, but of course the percent positive is still in a good area. So some concerning numbers there. Obviously, we're always concerned about each additional life that's lost to COVID. Again, mostly those in our senior population with pre-existing conditions. So we really need to lean into mask wearing, to making sure you're careful about social gatherings in restaurants, indoor spaces. Much safer to do activity and gatherings with family and friends outside. We celebrated my mother's 90th birthday outside at two of my brother and sister's place. Many of my brothers and sisters qualify to be vaccinated and are, but we all need to be conscious and careful of our mask wearing and social distancing. Our testing totals we've tested over 650,000 Delawareans, unique Delawareans, and administering $1.5 million tests. Our hats go off to AJ and his team and our partners with Curative and Vault, Newcastle County, and others that really have helped us. Here's the picture that really tells the story of COVID-19 over the last year in the state of Delaware, with the peak back in the end of April. April 17th was the peak of hospitalizations in April at 337. The decline in those hospitalizations in the latter part of April, May, as we moved into Memorial Day and on to the summer months, where we enjoyed very few hospitalizations, not a lot of positive cases. We were under 100 on a 7-day moving average towards the end of the summer. Again, twice that number today, and ticking up in the wrong directions, which is concerning. Our current hospitalization numbers, again, continue to tick up from March 9th to March 22nd. We did peak out a couple weeks earlier at over 450. We never tested, AJ, our hospital capacity, as those our partners in the hospitals really did a nice job of managing their census. They did have to put off voluntary procedures, elective surgeries, and the like. And so those of you who did that, make sure that you get back to your physicians and specialists in the hospitals to get that colonoscopy or that test done that needs to get done. We are really leaning into and putting all of our efforts into vaccination of Delawareans. You can see that we've administered 385,000 doses, which includes the federal pharmacy program. We do have some doses in transit moving from the delivery from the federal agencies to the state, from our warehouses to our partners, and then from our partners in the freezers and out into people's arms. As I said, today, March 23rd, we started the registration for Delawareans 50 years and older. You can sign up on the State of Delaware waiting list. I am in that population and did take the opportunity to sign up earlier today. There's the sign up website, vaccinerequest.delaware.gov. Get signed up and you will be made available for appointments to the vaccination clinics that we have at Curative, at Vault, and Dover Downs, and others that might crop up. There still will be access through our pharmacies. Pharmacies have already started vaccinating folks 50 years and up. They've prioritized teachers and educators and others that are their normal customers. We're really making progress. About over a quarter, over 25% of Delawareans have had at least one shot. A small number of those have received the 1-dose fully vaccinated Johnson & Johnson vaccine. We were advised this morning we will get significant increase in that allocation starting next week. So 1 in 4 Delawareans has at least one shot on their way to become fully vaccinated, and with significant 100% protection for death and hospitalization, both Pfizer and Moderna, as well as Johnson & Johnson. A little different for moderate symptoms, but still significant protection there. I mentioned the Dover Downs Speedway was stood up originally by our federal partners at FEMA, AJ and his team at DEMA, and at the Delaware Division of Public Health. Our partners with our Del.dot employees, boy, they've been fantastic, AJ, as they've managed traffic flow into the Speedway, traffic flow through the registration tents, into the vaccination tents, handing off to Delaware Army and Air National Guard. You got to put it to the Army and Air National Guard for their work, vaccinated by Newcastle County, Kent County, and Sussex County paramedics, by our Medical Reserve Corps, coordinated by our Lieutenant Governor and folks at the University of Delaware through the Division of Public Health. Lots of volunteers Lots of folks from Del.dot helping us. And Diane Hinsworth, who doesn't take anything from anybody, as this photograph should tell you. She's there with her arm in a sling. The other guy looks even worse. Diane, thanks for your tremendous work and for actually putting your health and well-being on the line. And we hope that your upper arm and shoulder gets better real soon. You can see we do provide transportation for those who are in a situation, maybe at an elderly residence or in their own home where they can't get to a vaccination site or we can't get to them. You can see the photograph there as we brought somebody in, a senior citizen was delighted to get transportation for her second dose. Our vaccination events, we get great work from the Delaware Army and Air National Guard. As I mentioned, they really have come up big. We're gonna need their additional help. General Berry, our thanks to the work of your men and women there at the Army and Air National Guard. We do have some guardsmen and women that are deployed in Washington, D.C. and still a few overseas, and we thank them for their service as well. As I said, the Del.dot guys have come up big, working the traffic through the Speedway. We appreciate that. DEMA, DHSS, Division of Public Health, Medical Reserve Corps, our county paramedics, the Speedway. I'll tell you, I don't know what we would do without Dover Down Speedway. Probably close to 10,000 or over 10,000 doses administered this past weekend, a little less, but a similar number before. All those folks in the restaurants, bars, first frontline essential workers have been vaccinated, educators, teachers, bus drivers, and the like, and our community partners. Thank you one and all. We've got a lot of work still to do. 25% of Delawareans have, more than 25% have already gotten at least one dose. We've got the single dose Johnson & Johnson vaccine on their way. We're off and running. We got Dover Down Speedway full out. Diane Hainsworth at the command, giving her right arm for the state of Delaware. We appreciate everybody's good work. Dr. Rattay, take it away.
Thank you so much, Governor. So let's talk a little bit about how we're doing in different parts of Delaware. As the governor mentioned, our case rate statewide has gone up slightly, about 3.8% since last week. So that is something that we are keeping an eye on. As you all know, we've been keeping a close eye on the Newark area, which is still a little on the higher side, but case rates have decreased in the Newark area. We've had about 60 UD-related cases in the last week. So that is an improvement from some previous weeks. Where we are seeing more activity right now is Wilmington 19801, 19805, Newcastle, as well as Greenville and Middletown. So those are areas that we are keeping an eye on at this point in time. Let's shift and talk about vaccines. At this point, we have administered at least 385,000 doses of vaccine in the state of Delaware, which is extremely exciting to us. And on the next slide, I want to talk a little bit about how many people have been fully vaccinated, which now if you look at My Healthy Communities, I mentioned last week, we're now including data on numbers of people fully vaccinated, which means they received either 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson. And that's over 135,000 individuals in our states. And another 121,000 have received 1 of 2 doses. So we have 126, almost 127,000 senior citizens in Delaware who are fully vaccinated, which is really exciting. And under 65, we have almost 53,000 individuals who are fully vaccinated. So we're really making some big strides. These numbers are also exciting. So 72% of our seniors have received at least one, if not two, vaccines. And when you look at our entire population that is eligible for the vaccines, eligible meaning the FDA's approved vaccines, Pfizer for 16 and up, Moderna and Johnson & Johnson for 18 years and older. We have 28% of the population that is at least partially protected at this point. So again, just really exciting to see the progress that we're making as a state around vaccination. So last week when we had our briefing, we talked about seniors and that we still wanted to make sure that seniors, especially those on our waiting list, had an opportunity to get vaccinated. And a lot of outreach took place to those seniors who were on our wait list and to there was a general invite to seniors across our state, even those who weren't on the wait list. And the reality is the demand is was clearly much lower for seniors. Now that doesn't mean obviously that we've vaccinated everyone. Our data just told us that around 28% or so still need at least one vaccine. But we know that to reach many of those, we need to implement different strategies, so more targeted approaches like some of the equity work that we have talked about. But it's clear that expanding vaccination access, that it has been the right time to expand vaccination access. So as you heard last week, those who have a chronic pre-existing qualifying condition who are age 16 and up are eligible now at this point to get their vaccine through their healthcare providers. Could be a primary care provider. Many are providing vaccine, but some aren't. But many people with chronic health conditions also receive care through health systems. And so make sure you check with the different providers on your healthcare team to see if they're vaccinating. And if none of them are providing vaccine and you're part of that list, or you have a chronic condition that fits on that list, then there's also all of our health systems have agreed to take referrals and to vaccinate individuals, whether they're their patients or not. So there are opportunities for everyone to get vaccinated who has a chronic underlying condition that's on the list on our website. And that being said, we know there's a lot of demand right now, and the same with pharmacies. For pharmacies, right now we're vaccinating individuals who are age 50 and up, but we know there's a lot of demand for those slots right now. So so be patient and keep trying if you're in that 50 and up category. But also for those who are age 50 and up, we have also begun our efforts to reach individuals in this lower age category. So as was mentioned, we have opened our wait list today, which I'll talk a little bit more about. We also, though, have expanded our efforts to reach those who are frontline or essential employees, which I talked about a few weeks back, but we've made a lot of progress since that time. So, we started with first responders, teachers, childcare, poultry plants, correctional officers. But since we've really expanded in the last couple of weeks to a whole range of employers, including grocery stores, food manufacturing, port, Amtrak, convenience stores, restaurants, farms and agriculture, personal services like hair, nails, veterinarians and their staff, higher education staff working in person, as well as county and local governments. And this week we added state employees, providing them with appointments at curative sites in Dover. So over the past 2 weekends at Dover International Speedway, we vaccinated approximately 17,000 workers in these categories, including teachers and childcare providers. And we'll continue to reach out to those groups for this weekend as well. We also continue our targeted efforts in underserved communities. As we have discussed for weeks, going directly into those communities to hold smaller vaccination events is how we know that we're going to be more successful in reaching individuals in our Black and Brown communities, especially. And this week we have 18 equity events scheduled that are coordinated by DPH and our partners, as well as a variety of other organizations. To date, since early February, we've had over 70 targeted events. We've reached well over 5,000 individuals through these events. We also, at our DPH state service centers, have reached 1,300 people, and in our DPH clinics, 2,200 individuals, all focused on reaching out to underserved populations. So we're going to continue these efforts. This is a really important part of our plan now and moving forward. But also an area that's really important to us is making sure that we're taking care of those in our state with disabilities. So our department's mission includes protecting vulnerable populations. And Secretary McGarrick has created, beginning in December, an internal work group that has been evaluating and addressing the needs of the populations served by our department. So during phase 1A, this group identified a gap in getting direct support professionals, home health aides, and others who support individuals with disabilities vaccinated. And to fill that gap, this team even stood up their own targeted vaccination clinics. Additionally, this group is really now very focused on ensuring that individuals with disabilities and their caregivers get vaccinated. So in partnership with such community providers like Easter Seals and Kent and Sussex Industries, this group has scheduled 6 vaccination events over the next 2 weeks for individuals with developmental and intellectual disabilities, as well as their caregivers. Those events will also serve individuals in congregate living and group homes served by the Division of Substance Abuse and Mental Health. So we're really excited about the work of this team and getting these events stood up, as well as work of this team to pilot delivery of vaccine to individuals who are homebound, many of whom have physical disabilities. And after an assessment of a pilot, plans are being developed in concert with partners to expand mobile vaccination to more Delawareans who are homebound. I just want to take a second to give a huge shout out to Melissa Smith and Marissa Catalan, who have just done an extraordinary amount of work to get these initiatives stood up and moving forward. This group is going to continue to assess the best way to reach individuals with physical and behavioral health disabilities as well moving forward. So just with these events alone, the work is certainly not done. But with the plan that we announced last week, we want to make sure that individuals also on the previous slide are aware that medical providers, healthcare system providers are really important, a really important avenue for individuals with disabilities to be able to access their vaccines. So certainly reach out to those providers, especially if you're under 50 with an underlying health condition. So for many with disabilities will certainly fit into that category, and certainly everyone over age 50 with or without disabilities are eligible to get their vaccine at pharmacies. And as the governor showed at our state events, we are prepared and very able to accommodate individuals with really any type of need. So lots of opportunities, but again, as we want to make sure that everyone is able to find their vaccines. So we at DPH are working with our other colleagues to make sure that there are pathways for people getting vaccinated in our disability community, especially those who are struggling to find a vaccine. So keep an eye on our website. We now have some new information up today for persons with disabilities, and we'll be expanding a contact point for those who are unable to find their vaccine in the next few days. So shifting gears to talk about our wait list, as we mentioned, it went live this morning. Vaccine request at delaware.gov, which is accepting names for Delawareans who are aged 50 and up for our state coordinated events. So when you get to the website, you'll be asked your name, your address, demographic information, whether you live in a congregate setting, like a group home, whether you have one of the high risk or moderate risk health conditions, and also whether you're a non-paid caregiver of someone who is at risk. And I think on the next slide, we go into a little bit more detail. Once you submit, so on the screen, you'll see that your submission was successful. Then you'll be on the list. And while we will begin inviting some individuals who are 50 and older off the wait list for Dover Speedway vaccination events this weekend, we certainly expect more people to sign up than we're able to serve in the first week or two. So don't expect an invitation right away, but we will be sending some out pretty soon. Really, just like we did with 65 and up, based on risk factors. So for those who are older or have more risk factors, should expect to get a vaccine sooner than a perfectly healthy 50-year-old. When you, so we are also starting a new appointment scheduling system, which we are excited about. That means that you don't have to act quite as quickly when you get your invitation to be able to get signed up. When you get your invitation, you will get a unique code that you need to use to register yourself for an event. So you'll be able to pick a day and a time for your appointment. That code can only be used once by one person at a time. And there is an avenue for those who don't have emails, or for those who have trouble by reaching out to our vaccine call center. There are individuals who can help them to either get on the wait list or to get scheduled for their appointments. Let me shift gears and just briefly talk about some updated guidance on schools. So CDC last week came out with some updated guidance on operational strategies for K through 12 schools. And this guidance recognizes that 3 feet of physical distancing between students and classrooms is sufficient as long as other protection and precautions are being followed. So those multi-layered protections that have been in place from the beginning, face coverings, again, are the most essential item for protection. But distancing 3 feet is now what CDC is recommending, which we've been recommending all along, as well as cleaning. And they also added some additional emphasis on the importance of ventilation as being vital. Again, these new recommendations really validate the guidance that Delaware that we released in the summer of 2020, and as some schools chose to stay at 3 feet. But now with this guidance, hopefully all schools will feel more comfortable going with the 3 feet, knowing that they can get more kids in the classroom. But again, the 3 feet guidance is really for the classroom when kids are seated and masked and facing forward. In other settings, like in the hallways, and especially when eating lunch, when masks are off, 6 feet is still recommended. We're also getting a lot of questions about buses. And so we wanted to touch base on that as well. Getting a lot of emails from people asking why can we still only put 23 students on a bus? So because we in Delaware did adopt the 3 feet recommendation in the summer and in the fall, we have all along kind of configured our buses so that students are 3 feet apart. And by having students be 3 feet apart, you can only fit 23 students on a bus. Again, even in that setting, everyone needs to be masked and facing forward. And we do feel that that is a safe setting. But there are certainly concerns about putting more kids on a bus that cannot be socially distanced, meaning that cannot be 3 feet apart. And while we will keep looking at this because we understand it is a barrier for getting more kids to school, we just aren't comfortable at this point going less than 3 feet distance for kids in school. So that's all I have for today. I'm going to hand it back to the governor.
Thank you very much, Dr. Rattay. A lot of information there. Again, the whole discussion about 3 feet, an issue that we've been following for some time. We've been at 3 feet as long as the children are in classrooms facing forward with masks and social distancing, and so not anything new here. It should give teachers, educators, and staff and parents a greater comfort level that it's been reinforced again by CDC, but this is advice that we received from CDC months ago, and we've got a lot of children doing in-person instruction, particularly those younger children in elementary school, children with disabilities, and our goal is to get as many children as possible in school for in-person instruction as soon as possible, and we're making progress towards that. Our efforts to test and vaccinate teachers and staff, as we have prioritized, and we've got probably a majority of those wanting to be vaccinated who've been given an opportunity to get a vaccine on the way. So we're making progress there. AJ has some information. His team is again working on 2 fronts, still getting people tested. It's tailed off a little bit, but we're still getting numbers in that exceed our original goal. We're not meeting the peak that we saw from December to January, but still a lot of good work there. And vaccinations continue to ramp up as our supply and allocation from the federal government ramps up. AJ?
All right, thank you, sir. Good afternoon, everybody. So Governor kind of led me in really well to what we're going to talk about today with testing. So we did see a decrease again last week. So this is 3 weeks of small decreases, about 500 to 600 each week, I believe. It's still above 34,000. And I say this, and this is not a capacity issue. This is just the demand issue. So opposite of what we saw back in November, December, and early January. We know we have 25 pop-up sites this week, and those sites are not at 100% capacity. So there's still demand for individuals to make appointments or show up. We also know we have the Walgreens, the state service centers, the walk-in clinics that are doing testing as well. So there's ample testing across the state. We just need to make sure people know their status. Check out de.gov/get-tested to find the locations closest to them to see what works for them. Again, we have the flyers that are out there on the website. Very easy. We update them weekly so people know what's in their community by county and available for them. So really, that's testing. Let's talk about vaccination. Dr. Rattay went over the complexity that we've had of making sure we have a methodical but quick approach to go from phase to phase as we target now those over the age of 50, those with underlying medical conditions, while also targeting essential workers across a number of industries. Several months ago, we brought on Curative, one of our testing partners, to really help with vaccinations, as well as another company. But just yesterday, they passed 25,000 vaccinations, and they're ready to triple this. That they could double or triple their throughput when the supply is there and ready for it to be turned on. So right now we have 3 static sites, 1 in each county. We have Wilmington open for 2 days. This week it's going to be 3. We have Georgetown open for 2 days, and then Dover's 5 days, Monday through Friday, just to kind of be that central hub. This week they helped us really have one last push for those over the age of 65. We had the understanding that a lot of individuals that signed up for this list had received their doses from whether it was their primary care, another state event, or possibly a pharmacy, but we wanted to make sure we gave ample opportunity to everybody to get a dose. So we kind of said, even though pharmacies are going 50 and over, we're going to email out all those individuals that are over the age of 65 to give them one last shot. And with that, our response was a little bit slower for the Dover site. So we opened that up to some essential Delaware workers, and then to the rest of the state employee workers yesterday that had the opportunity to fill about 2,000 spots this week in Dover. Next week, Curative is going to follow the same process that we use for the pharmacies. They will be targeting individuals over the age of 50 off the State of Delaware's website. So when we send people out the invitation, this will be one opportunity that they have to schedule for them. We do have a lot of second doses next week coming due for our Curative patients from earlier in the month. So won't be the 5,000-6,000 first doses, but a portion of that will be first doses. We're also learning as we come down this long runway of first COVID and the pandemic, and now the vaccination part of it. And we know that there is a disconnect at times with technology or people's ability just to book something a day, 3, 4, 5 days in the future. So tomorrow we're starting a walk-up test pilot with Curative in Wilmington by invite only with certain groups. We'll have some report out on that next week. Really trying to get to that 65 older and 50 and older community that might not be signing up for the wait list, might not be able to register or be on social media to see when these events open. And then also something that Curative is turning on for us and should help us, just as Dr. Tay said, we know there's people that can't sign up, is registration options. So we're going to use the partnership to call individuals that haven't scheduled their second dose yet. We'll start that in the next few weeks, and also maybe call people that have expressed an interest in being vaccinated and haven't been able to find an appointment. So we're still going to figure out where that works out the best through what community groups, but definitely an option that I think is going to help us with the experience of those trying to identify where they could get vaccinated. We have seen just in the last 2 weeks a much higher no-show rate at some vaccinations by the time we get to Thursday and Friday events. So we do know that people are maybe booking for a state event and then finding something at their local community pharmacy. And we want to make sure we're as efficient as possible. We get people in as quick as possible, and then that opens up that spot Friday, Saturday, Sunday to somebody else instead of pushing it off another day. So we continue to evaluate and modify as we need to be as efficient as possible. And as the governor said, as fair as well, as we make sure we identify those that need the vaccine the most. So Governor, that's it, back to you.
Yeah, great report, AJ, and hit on the main thing there, which is our goal from the beginning has been fast and fair, continues to be fast and fair. We need to be firing on all cylinders. We need to be moving vaccines into people's arms in every way we can to make it accessible to vulnerable communities, to make help those who might be a little bit hesitant to step forward and get their vaccines, to be able to do it and to ring up big numbers as we do at Dover Downs, to really be true to our commitment to essential workers, to people 65 and older. But we can't stop. We got to move. We got to open it up. We got to make sure that we're providing those prioritized populations with opportunities as we move in to fill other to ramp up because we're going to need that capacity, particularly as we get more allocation of vaccines, we get more people signed up. But that is, frankly, a message to those who do sign up. In order to get an appointment at Curative and some of these other sites, you have to be on the waiting list. You have to be registered. And that's a challenge on the equity side. And that's why we have the kind of outreach that AJ talked about. But if you are 50 years and older and you want to get vaccinated, make sure you sign up. It's an easy process, and we'll be able to make appointments available for you at Curative, at Dover Downs, and we would encourage you to take the first appointment that's available. So with that, we do have the media here. We appreciate their attention on a week-to-week basis and their attendance, and we open it up for any questions or comments that they might have.
First, we'll go to Tim Mastro from Delaware State News.
Hi, everyone.
Hey, Tim.
Last week, Governor, you mentioned the possibility of lifting some restrictions. I was just wondering if that's still the plan, and if you have any estimated timeline on that.
Yeah, it is still our hope. I'm a little hesitant now, given the numbers that we've seen over the last week. We're still working on it. There may be something this week. It depends on how these numbers trend. We did have a call, White House Task Force call, in which there was some concerning information shared about increased number of cases in other states. I think we're seeing it across the river in New Jersey. I did listen to the statement of Governor Murphy yesterday about, just being a little bit cautious and slowing things down. I am keeping my eye on what they're doing in Pennsylvania, Maryland, and New Jersey. We're kind of right in the middle there when you talk about capacity, and particularly hospitality, which there's a lot of attention on that. I'm a little concerned about St. Patrick's Day and the outcome of that frivolity. We'll see. We should be seeing it now. We're over a week out. So we're just a little cautious there. I expect to have something maybe this week, maybe next.
Mm-hmm. And then you brought up the issue of some hesitancy with the vaccine earlier. Are there any specific groups that you're noticing that in? Is that part of a challenge for your equity goals at all?
I think it is a challenge for equity goals, Tim. I don't want to jump the gun on that. I think some of those are a function of access. Some of those are a function of technology, a function of the fact that we move vaccine the fastest through the registration process. If that registration process is an impediment for you because you're not as plugged in technology-wise, you can sign up and register on over the phone. There's some friction there. What I'm hearing, and what we did have some focus groups done, and there's just a hesitancy among people to say, I'm going to see what my other family members experience. I'm going to look at what my friends do. That's why we're encouraging friends and families who get vaccinated to talk to their family members who are a little bit hesitant, to give them a little nudge to move them along the way. As you could hear, it's taking us longer to fill up the appointments, 65 and older. One of the reasons we moved and opened it up to take away some of that friction there, and to get more people that signed up for our mass vaccination events. But we'll continue to look at that question, particularly as demand starts to decline. We're not there yet, below maybe where the supply is. We expect to see a pretty significant increase in supply over the next several weeks, and we think our demand will keep up with that, but we'll learn as we go.
Next, we'll go to Brendan Holbeck with the News Journal.
Good afternoon, everyone. We've started to hear, probably in the past week, just since the vaccine process changed a little bit, more people, particularly going from Newcastle County to other parts of the state to get vaccinated, but maybe it's happening going from places southern, more northern. Is that something that you've heard, that people are taking pharmacy appointments or things of that nature elsewhere? And is that anything that would lead you to change where vaccines are going or how you're standing up these events?
Yes, we have heard it. It's clearly anecdotal. Obviously, you've heard it. We've heard it. Members of our team have heard it. So maybe it's more than anecdotal. We will continue to evaluate the throughput of all the pharmacies. We do that on a regular basis and make any modifications as may be necessary to better meet supply with demand. And that goes for the prioritized populations as well. We are opening it up to 50 and older now, more people in, but that doesn't mean we're putting aside priorities with respect to those with pre-existing conditions, our commitment to essential workers, our commitment to the Delawareans with disabilities, that we are factoring that into the invitations and for appointments that we make available. AJ, any comment there? I know it's something you and your team are looking at, Dr. Hong.
Yeah, no. So Dr. Hong, I know, watches this closely. Unfortunately, we don't see, we don't get the micro data of who's filling those appointments, but I believe there's also some logistics behind this too, right? We have to, there's a minimum shipment of vaccine that goes to a provider. So, I believe it's, one of the trays might be 100 doses. So it's, if you're putting it in some place that might not be as densely populated, there could be a little bit smaller curve of the supply and demand. So we do look at it. It's something we look at a number of factors based on all our partners, and it's something we look at weekly. And I'll tell you, we make sure the throughput is maximized as well as trying to be fair across the state.
Yeah, so that's really the point there, Brandon. That is, we're trying to match. We want fast and fair, and to get fast, you need to get it to folks that can move it. You don't want to see vaccines sitting on a shelf. At the same time, you got to look at your fair numbers to make sure you're getting fair distribution demographically in our state. And so it's a dual objective for us.
I'm curious about the walk-up pilot as well. What types of groups do you envision this being helpful for, and kind of how do you think that could operate once you go through the testing and kind of get it to a scale where you're going to roll it out?
AJ?
So no, thank you, sir. So Brandon, I think we're excited to see how it goes tomorrow. What we have to measure is how it slows down throughput, because individuals now have to register on site as they walk in. So, before Curative knew exactly how many people they could do in 15 minutes if people were showing up on time. So Lisa Henry worked with some other groups up in Wilmington to, really pass out vouchers for them to get there in half an hour time increments. We're going to try and do about 250 people tomorrow by, going through community groups, passing these out to individuals that were eligible by age, and areas that we may not have seen uptaken from before. So the thought is that if we can manage both reservations and some type of on-demand need as well when the supply allows us to, we want to do that. We want there to be nothing left in the fridge on site or the freezer on site at the end of the day. And that's our goal. So it kind of, what brings us up and makes it so important is what I talked about a few minutes ago. We know people are not showing up because they're booking at multiple potential vaccination spots to see what comes first. And that's great. They got it earlier, but we want to make sure then that shot that they had scheduled for tomorrow still goes in somebody's arm that's eligible. So once we balance out the operation and make sure we could and identify how many walk-ups we could manage in a day on top of 300 or 400 other people that have appointments, I think we're going to go out to groups and push this even a little bit harder to, make sure we fill the gap of those that might be, watching online and fighting for tickets, fighting like it was almost concert tickets online. So we want to be aware of everybody's needs and make sure we don't leave one part of the community underserved.
And the last point, Brandon, is the flip side of it. We can't have a surge in demand that overwhelms the site. We saw that, we learned that early on with the Salesianum event. We had a registration process, we had a targeted population, but it was not as tight as the way we've been working it with those vaccination sites since then, and we got overwhelmed. Word passed through social media. People called their friends and family members. They flocked to the site because they realized they could walk up and get vaccinated. They may or not have been eligible at the time, and we just need to make sure that we don't get overwhelmed doing that as well. But the goal, again, is to maximize the demographics and the equity goal that we have.
All right, next we'll go to Amy Cherry with WDL.
Hi, everyone. Thanks so much. We're hearing from people with pre-existing conditions that they're having extreme difficulty getting vaccine appointments, and they're not being referred to hospital systems or healthcare systems in some cases. What is their recourse, and who's responsible for educating providers?
Dr. Ratea, I think that's a question for you, but we made a determination. Obviously, this was a population that we wanted to make sure that we focused on. The challenge, of course, is to verify the pre-existing condition that they have, and we didn't feel like we had the capacity or the ability or the expertise to do that through our clinics. The best way to do that was through physician practices, their own physicians, hospital systems. And we asked those providers to take up that role, and they did it enthusiastically, frankly. So yeah, we do hear of problems anecdotally. Whether it's systemic or not, I think is a question Dr. Ratea might be able to address.
Yeah, so I mean, we know anytime you make a change that there's kinks in the system, and it can take a little bit of time for everybody to get on the same page, which is why we began to work with the health system, with the medical society and the hospitals days before making the transition. Every licensed medical provider in the state received an alert about the transition, and if they don't provide vaccine, how to refer patients. Perhaps some people don't read their emails. I know that Dr. Hong and Dr. Pescatore have a meeting with many providers tomorrow night. And hopefully if anyone's still confused, it will be clarified at that point. But we're certainly happy to hear about not happy. We'd like to hear about situations where people are struggling to find a provider or health system that can vaccinate them, so we can make sure that we do address any kinks in the system that remain. But again, as the governor was saying, we really feel like health providers are best to know who should be prioritized and who should be getting vaccine at this point in time. And if your primary care provider isn't providing vaccine, make sure that you keep in mind, any specialty care providers that provide your care, especially if they're connected with the health system, you should reach out to them, because that may be an easier way to find vaccine for those with pre-existing conditions.
Second question, at Friday's COVID-19 vaccination task force meeting, Dr. Hong mentioned that there was no projection for several weeks for how much J&J vaccine the state would be receiving. He mentioned a possible update to those numbers could be coming today. I'm wondering if you've received one.
Not that I know of. We had our White House task force conversation this morning. Jeff Zients did throw a number out nationally. I've not been able to translate that number to what we might get locally. My sense was that it was a fourfold increase on what they had done before, but that's very sketchy. We could try to get you an answer for that. It'll be much greater, much bigger than what we got. What was that, 3 weeks ago, 2 weeks ago? And their expectation is it will carry forward at that level and increase from there. So it'll be significant. Exactly what it is, we don't know yet. We can get you that information as soon as we know. Dr. Ratea, you have any more information on that?
No updates that I'm aware of yet today, but we'll eagerly keep looking.
All right, next we'll go to Nick Leno from Delaware Public Media.
Good afternoon, everyone. Dr. Rattay, you mentioned earlier the paratransit program that had that pilot down there in Sussex County, successfully delivering vaccine to people who were homebound or otherwise unable to make it out to vaccination events. I'm curious what the impedance is to expand that program statewide.
Yeah, well, right now we're working with some partners who are interested in playing a role in going out to individuals who are unable to leave their homes, and so we expect to have a more solid and actionable path forward very soon.
And then, Governor, you make it sound like the vaccine supply coming in is going to increase quite a bit. I'm curious how that might change distribution on the statewide level as maybe that eventually becomes no longer the limiting factor, our supply from the federal government.
Yeah, I've been anticipating for this for some time, Nick, and that's why we talk a lot internally about throughput, who has the capacity to move more vaccines. Some of our practices are topped out. Some of our pharmacies, I think, are topped out. Some pharmacies have additional capacity. I think the hospitals have a little bit additional capacity. Our outreach into vulnerable communities is very kind of time consuming, and the numbers aren't huge there, but the effort is really, really important. You heard me and AJ talking earlier about curatives additional capacity. Of course, that feeds in, that we feed them with the wait list. That's the best way and kind of the only way, I guess, that they work it. We do have Dover Downs, which is a great asset. We won't have it forever. We think we have it until early May, maybe mid-May. So that's not a lot of time. So, we hear the question, why are you opening it up to 50 and older and to other groups? And it's really to kind of maximize the output as that allocation of vaccine increases. And I'm concerned that I don't want to get to the day where we've got vaccine left over. We're far from that right now, Nick, but I want to make sure we're thinking ahead, thinking 1 week, 2 weeks or more down the road and making sure we have the capacity. Because in a week or two, that Johnson & Johnson vaccine is going to ramp up. It's going to go from nothing. We've been getting very little the last couple of weeks to something meaningful. The other vaccine, it sounded like, is going to increase and then be flat for a little while. We have second doses coming for thousands of these folks that we've just vaccinated, which will have to be delivered. So I just want to make sure that we don't, we match our throughput with the allocation we're getting from the federal government. And we need to find partners who can move more than they're moving now.
All right, next we'll move on to the pre-submitted questions. First question's from Cody Decker at WRGE. We heard from the Delaware Restaurant Association that 8,000 restaurant workers were vaccinated at Dover International Speedway over the weekend. Are restaurant workers considered frontline and high risk since they were invited? And do you plan to continue to get more restaurant workers vaccinated in the coming weeks?
Yeah, I'll let AJ and Dr. Rattay handle the priority list. They are frontline workers. I'm not sure we did 8,000, but I know that getting these workers vaccinated is critically important to our efforts to protect those businesses, to protect these employees, and to protect their patrons. We know that some businesses have been hurt more than others during COVID-19 the last year. Hospitality, restaurants have been hit as hard as anybody. And these are the workers on the front lines serving food to folks who are able to come in under the capacity restrictions that we have. I did see lists of people that were vaccinated at Dover Downs. It was a big number. I don't think it's 8,000. AJ and Dr. Rattay, do you want to talk in a prioritization question?
From a prioritization perspective, those who are in the food service industry really have been out there interacting with the public all along. And in fact, they're interacting with members of the public who often aren't wearing masks. So we were happy to be able to offer invitations to those in the food service industry for vaccination. We know that it's unlikely that it was 8,000 who were vaccinated, but somewhere around that many people were estimated to have received invitations.
Anything to add to that, AJ? We did have I did see that list, as I mentioned, a whole really good cross-section of businesses, towns and municipalities, restaurants and bars, lots of convenience stores, folks that interact with the public every day.
No, Dr. Rattay covered it great.
The second question from Cody Decker at WRDE is, does the state have a phased approach in regards to reopening? Meaning, will you prioritize certain businesses over others and open the state gradually? And what factors are most important when considering reopening?
Well, we don't have a phased approach like the one that we talked about in the spring as we reopened in late May, June, and July, where phase one, we moved so many businesses to certain capacity, but to a certain extent, we are working with individual sectors backwards, if you will, or forwards in terms of reopening. And we did that as we closed them down with greater restrictions. And now as we're getting healthier, we're trying to match the restrictions and the reopening with the conditions on the ground. We don't want to open a day too soon or a day too late. Striking that balance is challenging. And that's why the kind of uptick we're seeing in new positive cases, percent positive, and hospitalizations is a little bit concerning. Our total positive cases on a 7-day moving average is still a little bit high. It's twice what it was when we were arguing with New Jersey and Pennsylvania over quarantining Delawareans moving among the states at about 100. So we will gradually reopen. That was one of the things that Dr. Fauci said on the White House call this morning is make sure you have improving conditions. You're not plateauing out or going in the opposite direction. And whatever you do with restrictions, do it gradually. So I would say if you consider a phased approach, a gradual approach, yes. If you're thinking about phased approach, like it was, like we talked about phase one, phase two, phase three back in the spring, no, we don't think about it in those terms really now. We think about it more in terms of how to keep establishments safe as we relieve some of the restrictions and as the community gets healthier. Dr. Rattay, anything you want to add to that?
No, thank you, Governor.
All right, the next question is from Susan Canfora at Coastal Point. She asks, I live in Maryland, but I work in Delaware. My understanding is that I'm eligible to be vaccinated in Delaware, but I was told by Walgreens in Sussex County that I could not be vaccinated unless I had residency in Delaware. Is that correct?
Dr. Rattay, you might talk more generally about how we deal with residents from other states that work here and the kinds, as opposed to this individual case, but the implications, and we can deal with the individual case privately.
Yeah, so each state receives vaccine, based on their population, and our approach to vaccination here is for those who have a medical home here or pharmacy home here, but live outside of the state, they're welcome to get vaccinated in Delaware, especially affiliated with their medical home or pharmacy home. Those who are frontline or essential employees who work in the state of Delaware but live elsewhere are also welcome to accept invitations to workforce-related invitations. But as it relates to where we are with our vaccinating those who are 50 and older or underlying conditions, we are really focused on protecting Delawareans first.
All right, we have two more questions. This is from Katie Tabling at Delaware Business Times. She asked, with reports of President Biden's decision to accelerate vaccine plans overwhelming the system in North Carolina and Florida, is there any sense of how Delaware's system has handled an overflow of vaccine requests?
Yeah, so this question has been implicit in a lot of the things that we've talked about today with respect to changing levels of supply and changing levels of demand, which really, our answers really express our goal of doing fast and fair, meeting those objectives as the allocation of vaccines, the supply increases. So we expect supply to continue to increase in the original priorities. The demand on those lists of 1A frontline healthcare workers, first responders, then 1B folks over 65 has started to soften. Demand has softened, and as it softens, we have expanded and opened up to other populations, essential workers for essential employers, for our Delawareans that has pre-existing health conditions. We prioritize teachers and educators for really a little different reasons, and now moving again as allocation increases and demand in the groups that have been prioritized declines a little bit, trying to hit that right balance so we have enough of an uptake as we put appointments out there or invitations for appointments out there and solicit responses. And so we've tried to strike that balance. I think early on, the demand was way greater than the supply. The demand has softened, particularly as we've gotten more and more of the 65 and older age group vaccinated, as we've gotten most of the 1A folks that wanted to be vaccinated gotten their vaccines. And as we move into the other groups, it'll be interesting to see how fast we register those Delawareans between 50 and 65. As we've just opened up today, I think it was 7,500 from when it opened today to when we went live here. And again, we'll continue to measure that balance between supply and demand. We have not, other than at the very beginning, where we did get overwhelmed a couple of times, particularly when we didn't have registration systems tightened up like we do now. We will continue to try to find partners who can move vaccine quickly and fairly as it gets allocated to Delaware from the federal supplies.
All right, this is the last question. It's from Katie Tabling at Delaware Business Times. With dismantling the phase system, what would you say is your responsibility to those essential workers in phase 1C that have worked to keep the economy going in the past year?
Yeah, we think we're going to be able to get it to them faster. And we're going to meet our responsibility to them as frontline essential workers. We're expanding. We're getting more allocation, more supply of vaccinations. We're opening the opportunities to get registered. Where we are directly soliciting appointments or making available, inviting appointments from the 1,600 employers that have signed up with the Division of Public Health as an essential employer in our state, directly feeding them thousands of opportunities to get appointments at Dover Downs and at our other clinics, and we'll continue to do so. AJ, you want to expand on that at any? We have really, you look at the list from the last 2 weekends, and it's a big number representing a very strong cross-section of those essential businesses.
Yeah, so we had over 1,000 businesses that registered with public health since really the fall when they were talking about doing, whether they were essential personnel, where they fell in the risk waterfall, as Dr. Tay has created. The thought was some of those employers were going to take on the responsibility of getting individuals vaccinated on site, which I know there are some that we're still going to provide that way. But also we've had great success and throughput at some of these events in Dover. And, we'll continue to send out information to the contacts at these organizations. They can filter it through their employees and, we'll fill the spots. So I'm not sure if Dr. Tay wants to, we're not shutting it off after this weekend. We're going to kind of, just like everything else, we want to make sure the demand is there before we move on to something else.
I'll just say, I think the fact that we've vaccinated over 17,000 frontline and essential employees over the last 2 weekends and more this upcoming weekend says an awful lot about how we value the work that these individuals do.
So thank you for joining us today. We come to you today with mixed emotions, with heavy hearts over the loss of former Governor Dale Wolf, a wonderful Delawarean who really adopted the first state as his home state. 96 years young, great service to Delaware's corporate community as well as to the citizens of our state. Heavy hearts and sadness over the tragic shooting in Boulder, Colorado. And yet greater enthusiasm over our efforts here to vaccinate Delawareans. That light at the end of the tunnel is getting brighter every day. I see the relief and hear the relief in the voices of those that I meet at our Dover Downs Speedway vaccination clinic. You can feel the relief in their voices as they tell you about their experience. We encourage everybody 50 years and older to sign up and register on our list. And at the same time, we ask all of you to stay the course, to follow the guidance around mask wearing and social distancing. We've done great work over the last year. We rode this wave up back in April, down the other side in May, June, and July, up again in November and December, down now in February and March, and we want to keep it going down. We've got a little bit of an uptick now after St. Patrick's Day, I expect, but we got to push it down with mask wearing, social distancing, and being careful in public. Get vaccinated as soon as you get an opportunity to. You'll be better off, your family will be better off, and we'll be healthier as a state. I'm really excited about the economy of our state as we accelerate out of COVID-19. I had a BizNow conference this morning with business location experts looking at various regions, various states, and I'm very optimistic and bullish on the state of Delaware in the months ahead. Thanks for joining us, and we'll see you next time.